COVID-19. Symptoms, who is most at risk for the coronavirus disease, and how to protect yourself and others. What you need to know. Anyone can have mild to severe symptoms. Older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing more serious complications from COVID-19 illness. Watch for symptoms. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Fever or chills. Cough. Shortness of breath or difficulty breathing. Fatigue. Muscle or body aches. Headache. New loss of taste or smell. Sore throat. Congestion or runny nose. Nausea or vomiting. What is the difference between influenza, flu, and COVID-19? Influenza, flu, and COVID-19 are both contagious respiratory illnesses, but they are caused by different viruses. COVID-19 is caused by infection with a new coronavirus, called SARS-CoV-2, and flu is caused by infection with influenza viruses. There are some key differences between flu and COVID-19. COVID-19 seems to spread more easily than flu and causes more serious illnesses in some people. It can also take longer before people show symptoms, and people can be contagious for longer. Another important difference is there is a vaccine to protect against flu. There is currently a limited supply of COVID-19 vaccine in the United States, but supply will increase in the weeks and months to come. The best way to prevent infection is to avoid being exposed to the virus. Because some of the symptoms of flu and COVID-19 are similar, it may be hard to tell the difference between them based on symptoms alone, and testing may be needed to help confirm a diagnosis. Flu and COVID-19 share many characteristics, but there are some key differences between the two. While more is learned every day, there is still a lot that is unknown about COVID-19 and the virus that causes it. Who is most at risk for the coronavirus disease? Adults of any age with certain underlying medical conditions are at increased risk for severe illness from the virus that causes COVID-19. Severe illness from COVID-19 is defined as hospitalization, admission to the ICU, intubation or mechanical ventilation, or death. Adults of any age with the following conditions are at increased risk of severe illness from the virus that causes COVID-19. Cancer. Chronic kidney disease. COPD, chronic obstructive pulmonary disease. Heart conditions, such as heart failure, coronary artery disease, or cardiomyopathies. Immunocompromised state, weakened immune system, from solid organ transplant. Obesity, body mass index, BMI, of 30 kilograms per square meter or higher but less than 40 kilograms per square meter. Severe obesity, BMI is greater than or equal to 40 kilograms per square meter. Pregnancy. Sickle cell disease. Smoking. Type 2 diabetes mellitus. COVID-19 is a new disease. Currently, there are limited data and information about the impact of many underlying medical conditions and whether they increase the risk of severe illness from COVID-19. Based on what we know at this time, adults of any age with the following conditions might be at an increased risk for severe illness from the virus that causes COVID-19. Asthma, moderate to severe. Cerebrovascular disease, affects blood vessels and blood supply to the brain. Cystic fibrosis. Hypertension or high blood pressure. Immunocompromised state, weakened immune system, from blood or bone marrow transplant. Immune deficiencies, HIV, use of corticosteroids, or use of other immune-weakening medicines. Neurologic conditions, such as dementia. Liver disease. Overweight, BMI greater than 25 kilograms per square meter, but less than 30 kilograms per square meter. Pulmonary fibrosis, having damaged or scarred lung tissues. Thalassemia, a type of blood disorder. Type 1 diabetes mellitus. How to protect yourself and others from COVID-19. Know how it spreads. COVID-19 spreads easily from person to person, mainly by the following routes. Between people who are in close contact with one another within 6 feet. Respiratory droplets produced when an infected person coughs, sneezes, breathes, sings, or talks. Respiratory droplets cause infection when they are inhaled or deposited on mucous membranes, such as those that line the inside of the nose and mouth. People who are infected but do not have symptoms can also spread the virus to others. Less common ways COVID-19 can spread. Under certain circumstances, for example, when people are in enclosed spaces with poor ventilation, COVID-19 can sometimes be spread by airborne transmission. COVID-19 spreads less commonly through contact with contaminated surfaces. Everyone should wash your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place, or after blowing your nose, coughing, or sneezing. It's especially important to wash before eating or preparing food, before touching your face, after using the restroom, after leaving a public place, after blowing your nose, coughing, or sneezing, after handling your mask, after changing a diaper, after caring for someone sick, after touching animals or pets. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact. Inside your home, avoid close contact with people who are sick. If possible, maintain 6 feet between the person who is sick and other household members. Outside your home, put 6 feet of distance between yourself and people who don't live in your household. Remember that some people without symptoms may be able to spread the virus. Stay at least 6 feet, about 2 arms length, from other people. Keeping distance from others is especially important for people who are at higher risk of getting very sick. Cover your mouth and nose with a mask when around others. Masks help prevent you from getting or spreading the virus. You could spread COVID-19 to others even if you do not feel sick. Everyone should wear a mask in public settings and when around people who don't live in your household, especially when other social distancing measures are difficult to maintain. Masks should not be placed on young children under age 2, anyone who has trouble breathing, or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Do not use a mask meant for a healthcare worker. Currently, surgical masks and N95 respirators are critical supplies that should be reserved for healthcare workers and other first responders. Continue to keep about 6 feet between yourself and others. The mask is not a substitute for social distancing. Cover coughs and sneezes. Always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow and do not spit. Throw used tissues in the trash. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. Clean and disinfect. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Then, use a household disinfectant. Monitor your health daily. Be alert for symptoms. Watch for fever, cough, shortness of breath, or other symptoms of COVID-19. Especially important if you are running essential errands, going into the office or workplace, and in settings where it may be difficult to keep a physical distance of 6 feet. Take your temperature if symptoms develop. Don't take your temperature within 30 minutes of exercising or after taking medications that could lower your temperature, like acetaminophen. Protect your health this flu season. It's likely that flu viruses and the virus that causes COVID-19 will both spread this fall and winter. Healthcare systems could be overwhelmed treating both patients with flu and patients with COVID-19. This means getting a flu vaccine during 2020-2021 is more important than ever. While getting a flu vaccine will not protect against COVID-19, there are many important benefits, such as flu vaccines have been shown to reduce the risk of flu illness, hospitalization, and death. Getting a flu vaccine can also save healthcare resources for the care of patients with COVID-19. According to CDC. Gov source. Like and subscribe to 365 Days Healthy channel to get notified as soon as possible when I having a new video. Thanks for watching.